Now, some patients were able to get discounts, especially for like the first 3 to 6 months from the makers of these medications. But overall, an expensive medication was an expensive medication. Those were hurdles there. And then I think immediately what happened, because the market is the market, you had people who like, hey, there's this expensive medication out there, expensive brand medication. And then you had pharmacies and compounders, right? And this is a concept that I don't think a lot of people kind of recognize. Yeah, these compound pharmacies and independent pharmacies who are like, hey, you know what? We will make the generic version of that, right? And you know what? You pay us different, right? So then you had a whole market open up for people who couldn't afford the brand name, but they could get the generic name, right? So it was just a lot of news and fanfare on top of the fact that you had celebrities losing weight everywhere. You had all of these complications that would get highlighted, like, oh my God, frozen stomach. And I do want to, and I've talked about this, but I do want to just kind of mention the way some of these medications work, GLPs, right?